name is Julie Zeller, and this is my presentation, Healthcare Legislation and a COVID-19 Mental Health Policy Change. Objectives. After listening to this presentation, my colleagues will be able to understand the American Rescue Plan Act of 2021 by the 117th Congress of the United States of America. My colleagues will also be able to understand the importance of recognizing mental health issues in patients specifically related to the COVID-19 pandemic. The importance of a policy change that will help identify patients with mental health issues related to the effects of the pandemic will be evident, and listeners will be able to determine the effectiveness of the policy change. Thesis statement. The purpose of this presentation is to demonstrate how the American Rescue Plan Act of 2021 highlights the specific mental health challenges brought on by the particular circumstance of the COVID-19 pandemic, and to create a policy change to guide nurses to recognize patients who are in a mental health crisis related to the COVID-19 pandemic. The purpose of this bill is to provide the American people with aid and funds to overcome the obstacles created by the COVID-19 pandemic. This bill touches on many important topics. For example, education, mental health funding, housing provisions, and public health investments, such as COVID testing and vaccinations. This bill was introduced to the House of the Representatives on February 24th, 2021. It was passed by both houses of Congress with a 51% passing rate. President Biden signed the bill on March 11th, 2021, and the American Rescue Plan Act of 2021 became law. In this presentation, I'm going to focus on the mental health care portion of this bill. This bill provides $1.5 billion to continue support for mental health services during the COVID-19 pandemic. One focus of funding is for local substance use disorder services. A $30 million grant is given to state governments to support community-based, nonprofit organizations that provide overdose prevention programs and other substance use disorder programs. There is an increased need for these programs because of the novelty of this virus. People have increased fears and anxieties, including people who were never diagnosed with mental illness before. The bill also provides a $50 million grant to state governments to support primary care and behavioral health organizations because of the increased community mental health needs. The grant will also address surge capacity for mental health and behavioral health services. It will also support, enhance, and expand preventative and crisis intervention services. The American Rescue Act of 2021 will provide $20 million for youth suicide prevention programs to state governments and $80 million for pediatric access to mental health care. Policy change. According to the Online Journal of Issues in Nursing, Marcus Henderson writes that 50 million adults and 7.7 million children experience mental health illness in the United States of America. A policy change is needed in hospitals to help identify those patients who are suffering specifically from mental health issues related to the COVID-19 pandemic. The American Psychological Association states that during the pandemic, 13% of Americans reported starting or increasing their substance use as a way to cope with the stressors of the pandemic. These stressors have included stay-at-home orders, restrictive hospital visits, social and physical distancing, loss of personal interaction, job loss, and morbidity rates of COVID-19. There has been an uptick in fentanyl use and synthetic opioid use, which is produced illicitly. The pandemic has worsened an already prevalent mental health crisis in the United States. The American Psychological Association also reports that during the pandemic, there was an 18% increase in overdoses. The CDC reports increases in anxiety, depression, and PTSD. The pandemic has also led to an increase in suicides and suicidal ideations. In a hospital setting, nurses need to be more aware of possible COVID mental health issues for all patients, regarding of what they were admitted for. Nurses and providers need to be educated on what to look for in patients who might be struggling with COVID mental health issues. According to the CDC, people who had mild anxiety and other symptoms of mental health illnesses had increases in their symptoms during the pandemic. The pandemic has affected every single American. Some have suffered and lost more than others, and everyone is at risk for developing a mental health issue as a direct result of life under the pandemic. Healthcare workers need to be prepared to look beyond the mere physical issues of their patients and be cognizant of their mental health as well. Patient population. Life can be difficult, and all human beings are complex. Every person should expect that he or she may suffer from a mental health issue at some point. No race, age, or socioeconomic status is exempt from mental health problems. This policy change is to benefit every soul who is affected by the pandemic in any way. Acquiring stakeholders. Because mental health is so prevalent in the United States, acquiring stakeholder buy-ins should not be difficult. Mental health clinicians would be an obvious stakeholder to buy in because they are involved directly with these mental health patients whose symptoms could be exacerbated by the stress of living through a pandemic. According to the American Psychological Association, there is a shortage of these mental health clinicians, so it's especially relevant to make sure nurses can recognize patients suffering from mental illness. Another stakeholder would be local hospitals, who provide a considerable amount of mental health services. Hospitals will want to buy in to this policy change because the policy will help cut down on readmissions. No matter what issues have brought the patient to the hospital, their mental health status should be assessed. Patients who are treated for these uncovered mental health issues may decrease the need for qualified hospital staff, known as constant companions or suicidal ideation sitters. If patients who are suffering from anxiety, depression, and substance use related to the pandemic can be identified, then this will help eliminate possibilities of these patients being readmitted later for suicide attempts, overdoses, or other potentially dangerous acts. Another important stakeholder will be nursing organizations, like the American Psychiatric Nurse Association. This organization is consisting of over 14,000 members, whose main goal is to promote wellness through identifying, preventing, and treating mental health issues. Finally, police and EMS would be another essential stakeholder. Community members with mental health issues which have been dealt with would be less likely to reach a crisis stage necessitating a 911 call. Implementation and budget. This policy can be implemented by hanging flyers on all units, including break rooms, staff bathrooms, and nurses' stations. The flyers would include warning signs of patients struggling with mental illness, how to assess the patient, and who to notify. This is a relatively cost-effective way to spread the word because hospitals are already equipped with printers, paper, and ink. Another way to implement this policy change is by adding additional mental health assessment questions required on patient admissions. This will be a quick, easy way to identify patients who may need additional services and treatments for mental health while admitted. In addition to the admission questions, it is also essential that upon discharge, all patients receive mental health hotline numbers and locations of mental health clinics. Some hotlines are the National Suicide Prevention Hotline, the Substance Use and Mental Health Services Administration, or SAMHSA, Disaster Distress Helpline, and the Crisis Text Hotline. These additional features added to the electronic medical records would cost about $10,000, depending on the hospital's service contracts. Another method to implement this policy change is to require all staff to complete an online training module. A 30-minute interactive online training module will require about 45 man-hours to create and will cost about $5,000. There would be no additional hospital costs associated with trainings completed during work hours. Policy change teaching. All medical providers, including PAs, APRNs, nurses, and nursing aides, will be required to complete the online training modules. These modules will specifically address recognition of mental health issues related to the COVID-19 pandemic. This will be required of all service lines in the hospital. There will be also trained unit champions within each service line as a resource for staff members to go to if they have questions or concerns. Also, another great resource for all staff and service lines will be the creation of a committee on mental health awareness related to the pandemic. This committee will include all types of hospital providers from all service lines in the hospital. Each member will be able to discuss the common questions asked by staff members, the common trends being seen, and the effectiveness of the policy change. Determining effectiveness. In order to determine the effectiveness of this policy change, there would have to be a measurable decrease in the community mental health crisis, such as overdoses and suicides. This information can be obtained from our local police and EMS stakeholders. Another way to determine the effectiveness of this policy change is to have staff take a pre- and post-implementation survey. This would provide a baseline assessment and hopefully an upward curve in staff ability to identify potential patients with mental health issues. A post-survey would also determine how well staff members retained the information in the flyers and online trainings. Policy sustainment recommendations. Issues related to the pandemic will eventually decrease as the pandemic ends. However, mental health in general will always be prevalent and a main concern for this country. Continuing the online modules annually will allow hospital staff to stay briefed and informed on general mental health awareness. This will also allow for continued education for mind-body connections and recognizing them in our treatment plans for patients. Mental health plays a big role in overall health, and it's important to acknowledge it. Takeaways. In this presentation, I discussed a policy change in hospitals based on the American Rescue Plan Act of 2021 by the 117th Congress of the United States of America. In this bill, under Subtitle H, Mental Health and Substance Use Disorder, billions of dollars were funded to several community programs to help support people with mental health illnesses during the COVID-19 pandemic. This section of the bill is so important because mental health affects 1 in 5 adults, roughly 50 million people, and 1 in 10 children, roughly 8 million children. The pandemic added additional stressors such as job loss, social isolation, fear of COVID-19, loss of family members and friends, and financial burdens. These issues heightened the mental health needs in our country, as seen through increases in suicide and drug overdoses, specifically related to the pandemic. A policy change in hospitals is needed to help educate nurses and doctors on early recognition and warning signs of mental health problems in patients related to the COVID-19 pandemic. Thank you.